Hi, my name is Sharon Selagat, clinical nutritionist by profession, and currently taking nephrology nutrition under the Nutrition and Dietetics Academy. Today, I'd like to talk to you about nutritional aspects in both post and pre-kidney transplant, nutritional aspect of both. Let's start with kidney transplant. What is a kidney transplant? So, kidney transplant is a surgical procedure to place a kidney from either deceased or from a live or a deceased donor into a person whose kidney have failed. Renal transplantation is a preferred method of treatment for end-stage kidney disease. Successful transplantation of kidney to a patient whose kidney have failed restores near to normal function of the kidneys. In minds of both the patient and the physician, one of the major benefits of renal transplantation is to end the dietary restriction required for the therapy during the period of progressive renal failure and dialysis. So the guidelines that we review in this topic today, we review on the importance of nutrition, the food safety guidelines, and the potential dietary restrictions that one may experience after the renal surgery. What are the main function of the kidney? One, it's excretory. The kidneys are able to, one of the major function of the kidneys is to excrete the waste products from the body, and then it's able to balance the electrolytes and the fluids from the body, and then it's a major organ that produces some major hormones that are used in the body. The most common diseases that affects the kidney, one is diabetic nephropathy, which is the damage to the nephrons in the kidneys from unused sugars in the blood. Usually it's due to patients mostly that have diabetes. Then we have the high blood pressure, which can damage the small blood vessels in the kidneys. The damaged vessels cannot filter poison from the blood as they are supposed to. Then we have the polycystic kidney disease. This is a hereditary disease. Usually, if a parent has a disease, it usually carries it through this to the kids. The cyst grows on top of the kidneys, and it leads to kidney failure. Then we have the acute renal failure. This is a sudden kidney failure caused by blood loss, or it can be caused by drugs or poisons. If the kidneys are seriously damaged, then it can, if the kidneys are not seriously damaged, usually it reverses itself. Then we have the chronic renal failure. This is a gradual loss of the kidney function. Usually it leads to chronic renal disease. Then we have the main one, which is actually now the end-stage renal disease. It is a condition of totally or nearly totally and permanent kidney failure. So, what are the options of kidney failure? One, we have the conservative management. Usually a patient is put on drugs to recover. Then we have hemodialysis, usually is for the patients who have kidney failure. Then we have what we call peritoneal dialysis. Then we have the kidney transplant. So our main focus today is on kidney transplant. So what is a kidney transplant? Kidney transplant is a surgical procedure. Usually it's not a cure, but a treatment. The good thing about kidney transplant is there are fewer restrictions, and then usually the patient gains weight after the transplant. Then usually it doesn't have a lot of restriction. So what is very important about what is the very important nutrition aspect about kidney transplant is the kidneys I ensure the most important, why is nutrition very important for patients who have undergone kidney transplant? They are able to meet their nutritional needs. They are able to reduce symptoms like nausea, vomiting, itching, and bad taste, and control the buildup of the waste products in the body. Then prevent infection, and they ensure that they get the adequate energy that is required by the body, and also helps control high blood pressure in case of diabetes, and also high blood sugar in case of diabetes, and also high blood pressure. So what are the most important nutrition aspect before transplant? Nutrition plays a very, very important role for patient after they receive a transplant. So proper nutrition is very important. This is maintaining good protein stores. Then we have obesity, or the body mass index. It's very important for a patient to make sure that their weight is within the boundaries of the body mass index, so that if they are overweight, they aim at losing some weight, and also they need to control their they need to do an exercise program in order to control their weight. And then we have bone concerns. Usually for patients, especially those who are undergoing dialysis, they usually get a bone disease called secondary hyperthyroidism. It's very common, and usually it causes elevated levels of PTH, with the parathyroid hormone. The increased levels lead to weakened bones, and usually it causes also risk of getting a heart disease. Then we have the cardiovascular concern. People with kidney disease usually get kidney transplant. They are always at a higher risk of getting heart disease, high cholesterol, and sometimes it's very, very important for them to do some exercise, and also they can be controlled through medication. Then we have what are the major concerns after kidney transplant? The major concern is weight gain, risk of cardiovascular diseases, and risk of developing diabetes, new onset diabetes, and even they are unable to control their blood pressure. What are the nutrition aspect after the transplant? One is weight gain. Some people gain weight, some people don't. What is very important is that you should know that it's within your control. Whether you gain weight or not, it's within your control. It depends on how much you eat and how much you exercise. The main notion about kidney after the kidney transplant, so many people think about it's you can eat whatever you want. Yes, this is true, and it may be true or it may not be true. Many foods that are often limited during dialysis, usually patients are allowed to take after the transplant. Nutrition also after transplant is very important to take a high fiber diet, which include whole grain, vegetables, and fruits, and then avoid sugary foods or foods that are high in sugary. Then the main thing about fruits, they should avoid also grapefruit, because they alter the activity of their, usually the common drug, the anti-rejection drugs they take. So usually encourage them again to take to choose a high protein diet for their to help in healing after the surgery. They also are encouraged to keep hydrated at all times, and avoid juices and drinks that are high in sugars, because they can raise your blood sugar. What is encouraged is mainly just plain water. Then also maintain moderate sodium restriction, and then also always follow the food safety guidelines, and then usually again, to some patients, they need to control their potassium. What about food safety? It is very important that your foods should be cooked well, should be cooked well, and also stored well. This is to prevent rejection and also to prevent infection. Avoid foods from street vendors, because the hygiene, maybe they will be undercooked, or they will be under the hygiene, the preparation, the hygiene under the preparation of the foods. Then nutrition levels is very, very important. Before you buy any food, just check the labels. Then fruits and vegetables should be washed under running water, mainly before preparing them. Then sanitize every time. Then wash your hands most of the time with soap and water. Then also encourage to limit movements. If necessary, consult your doctor if you have to go to a far place, or you have to move. Then wear mask, especially the first 3 months after the transplant. This is just to avoid infection. Then maintain a high, good standard of hygiene. Then in conclusion, kidney transplant remains the most preferred treatment to kidney failure. As we celebrate World Kidney Day in the coming week, let's remember to take care of our kidneys. If you are a diabetic, then you need to control your sugars. If you have blood pressure, then you need to control your blood pressure through medication. Wow. Thank you.